Today, we are going to talk about the metabolic syndromes, which is actually a cluster of interrelated metabolic abnormalities. And this includes central obesity, dyslipidemia, hyperglycemia, and hypertension. And these all conditions increase the risk of cardiovascular disease and diabetes. So Ayurveda, which is a holistic traditional system of medicine originating in India, offers a complementary approach to managing these conditions. And here we're going to talk about the role of the Ayurvedic interventions, including herbal remedies, dietary practices, and lifestyle modification in minimizing the components of the metabolic syndrome like this. And we are going to talk about the evidence, the mechanistic insights, and also scientific basis about their use. So if we think broad, metabolic syndrome affects almost 25% of the global adult population, and its prevalence rising due to lifestyle and dietary changes. The conventional treatment focus on the pharmacological intervention to manage the individual component of metabolic syndrome, but these are often with adverse side effects and has limited holistic benefits. Ayurveda offers an integrative approach targeting the root cause of the metabolic imbalances or abnormalities while promoting the overall health and well-being. When we talk of the pathophysiology of the metabolic syndrome, and also we talk about its Ayurveda perspective, we know that the metabolic syndromes are manifestation of kapha and meda's imbalances. And this is aggravated by the poor dietary habits, sedentary lifestyle, and stress. According to Ayurveda, digestion and metabolism are governed by Agni or digestive fire, and its dysfunction lead to accumulation of ama or toxins, contributing to metabolic disorders. Ayurvedic interventions aim to restore the balance of doshas and enhance the Agni to address the metabolic dysfunction, and that is the root cause for the obesity. Ayurvedic interventions for metabolic syndrome include herbal remedies. For example, Triphala, which is blend of 3 fruits, Amblica officinalis, Terminalia cibula, and Terminalia balearica. And this Triphala, which is combination of all 3, is shown to improve the lipid profile and reduce the oxidative stress. The second herbal remedy is Gugulu or Commiphora mucul, and this is known for its lipid-lowering properties through its ability to enhance the bile acid excretion and modulate lipid metabolism or fat metabolism. The third herbal remedy is Ashwagandha, which is also known as Vitania somnifera, and this exhibit adaptogenic and anti-inflammatory effects, and that helps to reduce the oxidative stress which result into metabolic disruptions. The fourth herbal remedy is fenugreek or Trigonella phoenum graecicum, and this contains soluble fiber that improve insulin sensitivity and the glycemic control. So after the herbal remedies, we talk about dietary modifications. Ayurvedic dietary recommendations emphasize balanced meal tailored to an individual constitution, which is Prakriti, according to Ayurveda. And this must focus on the whole grains, fresh fruits, and vegetables. Spices such as turmeric or curcuma longa and cinnamon are incorporated for their anti-inflammatory and insulin sensitizing properties. The third part after the herbal remedies and dietary modifications is lifestyle practices. Yoga and pranayama practices on a regular basis, including the yoga postures and breathing exercise, improve the insulin sensitivity and reduce the central obesity and also lowers the blood pressure. Dinacharya or daily routines encourage the oil pulling and meditation and early meals in form of daily life optimize the metabolic health. The fourth component is Panchkarma therapy or Panchkarma detoxification procedure, which include virechan or purgation, basti or medicated enemas, and these are known to eliminate the toxins and improve the gut health and also reduce the metabolic function. Now we talk about the scientific evidence for supporting the Ayurvedic medicines for this purpose. A randomized controlled trial demonstrated the efficacy of Triphala, including the reduction of BMI, the waist circumference, and triglyceride levels in obese individuals with metabolic syndrome. The systemic review highlighted in lipid-lowering effect of Gugulu in patients of hyperlipidemia, reporting the significant reductions in the total cholesterol and LDL levels. So the first one, the study we talked about is I will give you the reference table down. It's volume 67, page 123 to 30. And the second one is page 45 to 53. Yoga and pranayama interventions were shown to improve the fasting glucose and HbA1c level in the cohort of patients with diabetes and metabolic syndrome, and this on volume 55, page 89 to 95. So the reference table will be given on the bottom. Now we can talk about the challenges and the future direction. And we know that despite promising evidence, the widespread integration of Ayurvedic medicine in management of metabolic syndrome is limited by lack of large-scale, high-quality clinical trials. And therefore, future research must be focused on elucidating or incorporating the metabolic syndromes and the molecular mechanisms underlying the Ayurvedic intervention and conducting multi-center trials to establish their efficacy and safety. However, we can say that Ayurvedic medicines and the practices provide holistic and complementary approach to managing metabolic syndrome. By addressing the root cause of metabolic dysfunction and promoting the systemic balance, Ayurveda offers a promising avenue for reducing the burden of metabolic syndrome. Bridging the traditional wisdom with modern scientific validation could pave the way for integrating the healthcare solutions and provide better outcomes.